Do you want to know how to stop peeing when you laugh? I know that seems like a pretty funny title. I actually have an ebook that's titled How to Stop Peeing When You Laugh. And a lot of people have enjoyed learning more about how to stop peeing when you laugh. I know, it's pretty funny. That's the point. It's meant to take something that's kind of a serious issue and affects a lot of people and make it a little bit funny so we can all kind of have a laugh about it, realize that we do pee when we laugh, and today we can figure out more about what to do about it. So I'm Dr. Amy with Physical Therapy for Everybody. And one of the things that I'm really passionate about is helping women be able to live their best lives, particularly when it comes to issues in the pelvic floor and pelvic floor dysfunction. And the most common one that I see in the clinic is women who have difficulty controlling their urine or they pee when they're running, jumping on the trampoline, doing jumping jacks, other forms of exercise, or even when they're playing with their kids. And I've had a lot of women come in and tell me that they think it's normal because it's happening to all their friends. Well, I will agree with you that it probably is happening to a lot of your friends, especially those who have had children. It can even happen as we age, but it's not normal. That's not how your body is supposed to be. Our body is actually designed, the pelvic floor is actually really strong. And although it does change as we age, it doesn't have to cause you to start peeing yourself when you're laughing or jumping or running or sneezing or anything like that. So that's what we're going to talk about today, is what is considered normal and what it is that you can do about it. So if you find yourself peeing when you run, jump, laugh, cough, anything like that, there is something that can be done about it. What we do here in the clinic is we figure out why exactly your pelvic floor isn't working correctly, which there's a number of reasons that that could be, and then we figure out what we need to do about it. So it can be something super simple like this. I had a patient who I was working with at one time, and I was actually working on her neck, like nothing to do with the pelvic floor or the back, anything like that. And as I was working on her neck, she happened to mention, so she's a huge Seahawks fan, like the biggest Seahawks fan. And so she happened to mention that she would go to the Seahawks game, and when she would jump up and cheer, everything would come out. In fact, it was so bad that she had to bring a second pair of pants to the game so she could change before she went out to the car because she didn't want to get everything everywhere. And she was wearing a Depends actually when this happened. So even with the Depends, she would still flood her pants and have to change before she went to the car. And she just happened to mention it casually. And she was like, "Do you know anybody who deals with that?" And I was like, "Well, actually, I deal with that." But we didn't have time to do a full evaluation during that session because I was, like I said, busy working on her neck. So I said, "Here you go. I'm going to give you this simple exercise. I'm going to have you do it. I'm going to check back in with you. That may solve the problem altogether. It may, we may need to do more evaluation. Let's just try this and see." And she was like, "Okay, great." It's a really simple exercise. It's not that hard to do. She did it for a month. And when I saw her a month later, I said, "Well, how's your neck? And how do those exercises work for you?" And she said, "I got to tell you, I went to the Seahawks game on Sunday, and it had been a particularly exciting Seahawks game. And I jumped up," and she's like, "and a little bit came out, but it was only a little bit, and it stayed in my Depends." She said, "It was the first time I have gone to a football game and not had to change my pants in as long as she could remember." It was one simple exercise that literally changed her life and how she was able to show up in the world. Now, that's definitely an extreme case where one exercise can totally transform that. I can't guarantee those results for everybody. Some people, it's way more complicated because there's way more stuff going on that's causing that problem. But I wanted to give you some hope that if you have given up and just started wearing a pad when you go to the trampoline park, you don't have to do that. You have a choice. You can choose to wear the pad when you go to the trampoline park and just know that's what you're going to do for the rest of your life, or you can choose to do something about it and actually take control of the situation. So if you find yourself at the trampoline park, you don't have to worry. If you have any questions about this, I know a lot of people probably won't want to comment here in front of everybody. Feel free to drop me a direct message. I'd be happy to talk to you. We could hop on the phone and talk, or have you come in so we can talk in person. I get that this is a sensitive issue, and I get that people don't want to talk about it, but it's important for us to talk about it. It's important for you to know that there are options out there, and you don't have to choose to live your life like this. And it's important for you to get the help that you need. So feel free to drop me a direct message. You can give me a call. We can schedule a phone consult. But let's get you on to living your best life. I hope you guys have a fantastic weekend, and I look forward to seeing you next week.